Hi everyone. This is Dr. Geeta Nagasri Neerukonda, Senior Surgical Oncologist at CARE Hospital, High Tech City. The most common cancer in women right now is breast cancer. Is the number one cancer worldwide. Previously in India, cervical cancer used to be number one cancer in women, but recent years breast cancer has overtaken cervical cancer, and in India also it is the number one cancer. And the statistics is telling that 1 in 28 women is likely to get breast cancer. This is so high. Why? This is a disease of West, we used to call previously. Why in India the figures are growing so high, so rampant in India? The main cause being the rapidly changing lifestyle in women in India, westernization. Everything has changed in women's life, like age of menarche has reduced. Previously, in last generation, it used to be 14 and 15 years, the age of menarche. Now it has become 10, 11 years only. Age of menopause has increased. Previously 45, 48 years, periods used to stop. Now 51, 52, even 53, 54 also women are getting their periods. And number of children have come down. Previously they used to have many children, more than 5, now 1 or 2 children for every woman. And lifestyle have changed, obesity, sedentary lifestyle. 40% of the teenage girls are having polycystic ovaries nowadays. These are all risk factors. Like number of years of hormone exposure has increased. That this is a main reason for increase in these women's cancers, especially so breast cancer. All actually, and not only that, the food we eat, the water we drink, the air we breathe, everything is more polluted now. All these factors are contributing to the increase in cancers in general and breast cancer in particular. And peculiarity of breast cancer in Indian women is the average age of breast cancer in Indian women is 10 years less than the West. So engage women, it is in the West it is a 50 to 60 is average age. In Indian women it is a 40 to 50. So younger the age, more aggressive the tumor is. So and most of the Indian women, more than 70% of the Indian women come to the doctors in the late stage, because when we see the statistics in US, 5-year survival rate is more than 90%. In China also it is more than 80%, but India it is still 50%. That means every 2 women diagnosed with breast cancer, we are losing 1 woman of breast cancer. What is the main reason? Culprit being the negligence on the part of women, late diagnosis. Whether woman is aware now because of all these social media or whatever we do, I don't say that awareness is not there. Women is aware that there is something known as breast cancer that can happen for any woman. But once they feel their lump in the breast also, once they feel the lump in the breast also, they go to the doctor very late. And once they reach to the doctor once they are in 3rd stage or 4th stage only. That is a very unfortunate thing in Indian women. Actually, how to reduce the mortality in Indian women? Only way is we don't have population based screening in India. In Western countries, when you fall into that category, according to the American Cancer Society guidelines, women above 45 should definitely get mammography yearly. But average age of incidence of breast cancer in women is 10 years less. For in India, we had to start from 40 years only. What I feel is every year 1 mammography or ultra screening sonomammogram will save lives of many women, because once it is palpable means already the lump is 2 centimeters. Once it is 2 centimeters, it will spread to other, the tumor cells will disseminate into the blood. So we had to catch it in very early stage, that is in millimeter size. How only we can catch it in the millimeter size once we go for the screening mammography. So every woman should undergo screening mammography yearly. I always tell, whenever I go to address the women's organization or women group, I always tell, nowadays we are not even getting one saree or dress less than 3,000. Forgo one saree or one dress and please get your regular checkup mammography done. So many lives, so many women's lives will be saved. So once, okay, unfortunately once the breast cancer is diagnosed, what should we do? Women should not feel apprehended. You should not be scared. You should think that it is like any other disease, any other chronic disease like diabetes or hypertension, and get the treatment done with a good positive attitude. Then definitely early stage recovery is more than cure is more than 90% in breast cancer. We do multimodality treatment in breast cancer: surgery, radiotherapy, chemotherapy, targeted therapy, now immunotherapy, everything. So surgery, not like previously, if breast cancer is diagnosed, that we had to remove whole breast and limb will be swollen and all. Not like, if it's come in early stage, we needn't have to remove the breast. We can save the breast, only that lump with the surrounding normal margin we remove, and axillary clearance we do. That also, if node seems to be negative, we can go for the sentinel node biopsy. So breast will be like any other breast, contralateral breast only. So we needn't have to do mastectomy in breast cancer. We can go for the lumpectomy. Lumpectomy with radiotherapy, the results are same. Survival is same, and recent studies are saying that survival is even better than going for the mastectomy, complete removal. So technology has improved, everything has changed. The surgery has become less and less invasive, and chemotherapy also, targeted therapy has come. And chemotherapy, there is a good drugs to tackle the side effects of the chemotherapy. Radiotherapy also, precision therapy has come. Precision therapy means, previously when you give radiotherapy to the breast, the chest wall, lungs and heart also used to get a lot of dose, and there used to be side effects on that. But now the side effects is minimized to other normal organs, and only the part is receiving the radiotherapy. And nowadays immunotherapy also have come in advanced stage. We are giving even immunotherapy. So we are targeting the cells, like tumor cells are taken out and grown. Antibodies are grown against those tumor cells and injected into the body. And so technology has so developed, and research is day by day improving. We are getting newer and newer drugs day in and day out. So no need to get scared. You should, with the positive attitude, women should undergo the treatment.